Hello, how are you? And congratulations for those who are new in this channel and for those who've been flowing with us in the series. Actually, congratulations because you are almost graduating to being the best writer of a care plan, because this is our last part of the series. For the new ones, welcome again, and if it is your first channel, this is your first class to join, you can go through the other parts of the series, because this has been a series of how to write a proper nursing care plan, and we've been going through this journey from the basics, that is introduction to nursing care plan, defining its importance and significance. We looked into the components or parts of the nursing care plan. We gave a few examples here and there in terms of diagnosis and goals. And now we are in the last part of looking at how do we write a proper care plan using an example. So we'll look at a few examples of nursing care plans that can actually be of importance if you're a student or a nurse somewhere who has been struggling in this area. To do this slowly. Remember, my mantra in this series is to do it so slowly so that everyone can actually flow and get to understand. In any document in nursing, please remember every part of it should have the biodata of your patient. So all the nursing care plan have the beginning part. So here we have the nursing care plan, details, but these details are what we call the biodata, or the data of your patient. So we have the age, date of admission, diagnosis or the disease the patient is suffering from, occupation, religion and ethnicity. Some of them will have the name of the student who is writing. Remember, we are using the student care plan format. So the name of the student who is writing this care plan, the date of care that they have been doing this care plan with the patient, and then the actual date of the care that the patient is being done on. However, here they are supposed to also have the patient name, bed, and all those. However, let's go and focus on the areas that have importance. And this is the columns of assessment, diagnosis, goal and planning, interventions, implementation, and evaluation of our patient. So the key parts here that we begin this document on are the assessment data and the nursing diagnosis. These are very, very key parts that you should never mess up, because if you mess your nursing data, your nursing diagnosis also will mess, because it's a series, it's a process, it's a flow. So you need to ensure the part starts correct before you finish, because if you do not understand the beginning, then the evaluation, which is the end part of your care plan, will not come out clearly. So I want to do a recap of these parts so that when we go to do the actual care plan, you will understand. So the example I'm having here has combined both data and diagnosis, which is fine, because in these notes we're just going to measure on few areas, not stories and all that. We're just recapping. So on first, you're being told the nursing diagnosis, which I also had said before, you need to prioritize your diagnosis, and we told that at least have 4 nursing diagnoses in your care plan, which is a very good basic for you to do, whereby at least you have 3 actual diagnoses and 1 potential diagnosis. So in prioritizing your nursing diagnosis, we mean how are you going to put your diagnosis in a way that you have a priority. You don't just manage from the least to the severe. You start from the severe to the least severe parts. So prioritize the nursing diagnosis. The other part is you're being told give specific and complete subjective and objective data that will be supporting your nursing diagnosis. So this is where the assessment comes in. We said when you're assessing this patient, ensure that you are exploring as many sources of data as possible. Check the medical report, check the other nursing comments, check the physical examination, do your history taking again, gather as much information around your patient as possible. Then give a true picture of your patient. Do not theorize your patient. I know some of us are tempted sometimes. You assume because someone has pneumonia, then they'll be having congested chest. Please do not put theory of your patient. Put that patient in their real picture. If the chest is not congested, do not write congested chest there. Please write the exact state of your patient. Then the other thing is get all your nursing diagnosis from the NANDA. Please, if you don't have NANDA or have no idea how NANDA looks like, it's all over the internet. Just Google it or search it and you'll get the source. Go through the NANDA list and understand that's where you get the parts. We're using NANDA because this is the conventional source of nursing diagnosis for all the nurses in the world, and you do not want to be practicing in different parts of the world and wondering why are we having differences. So for uniformity and unity in the nursing practice, NANDA is the chosen list that should be adhered to when writing your nursing care plan. So the nursing diagnosis here comes in three parts. The first portion is either the potential or the actual step, which you actually get it from the NANDA. The second part of your nursing diagnosis is that part that is made of related to, and the last part is the evidence or evidenced by. So when back to priority, when you're prioritizing, you're told you need to use a criteria of priority that you're using. Is it functional levels? Is it Maslow's? Are you using pathophysiology? Are you using symptoms? Tell us which criteria you are using to highlight your nursing diagnosis. But anyway, let's go back to this diagnosis in itself, in its format. We've said it has three parts. So it has the potential or the actual step, which is stating the state of our patient. So like ineffective airway or ineffective airway clearance or ineffective breathing pattern, those are potential or actual diagnosis. Those statements, you get them from NANDA. You will not get them from your mind, or you will not generate it from your own brain. Refer to them from the NANDA booklet. Then when it comes to the second part, which is the related to area, the related to stem is for you to relate your potential with different parts. You can relate it with pathophysiology, where we talk about etiology. You can relate it to factors that are causing the disease, or you can talk about the causal effects, discuss it there. But the related to is simply exploring how much do you understand of the disease. And this is where most students and even practitioners lose, because majority of us, maybe we read about that disease a long time ago, and there you have a condition that you need to describe its nursing diagnosis. So you're not able to properly bring in those pathophysiology history that you know. You're not able to pull together the little notes that you read in your nursing school. So that's why I say, to be an effective nurse, please be reading at all times. Don't neglect your books or your references just because you graduated. You will still need it. So related to is simply a reference to your etiology or factors that are causing the disease, or the pathology that is contributing to the problem and the symptoms that you're seeing in your patient. Then the last part is the evidence, what can normally be written as AEB, or if you like it in full, you can just write as evidenced by. As evidenced by are simply the symptoms or the data that you evaluated on your patient that indicated the specific diagnosis that you wrote there. So this includes the signs and symptoms that are being demonstrated by your patient at the particular time when you are assessing to get the subjective or objective data from this patient. So nursing diagnosis and data, they have to go hand in hand. Get proper data, get proper details from your patient, generate the nursing diagnosis, and put it in a priority. Please, I repeat, use NANDA to generate your nursing diagnosis. And the second part now is where you're coming in with your goals and outcome. And you have ensured and say that ensure your goal and objectives are SMART, that is specific, measurable, attainable, realistic, and time bound. Again, when you're doing the components of your goals, they should have 4 components, and that is the subject, the verb, the condition, and lastly the criteria. So when you put together all these goals, you are sure to bring it together. So in this case, the goals and objectives are simply what the nurse tends to or is actually expecting to achieve at the end of implementation of the care plan. Here you will not state the nurse will, but you will use their statement. Will either start with patient will, client will, or if you know the name of the patient, then just write John will. That will make it more specific and realistic. And then after writing the goal, you need to go to the interventions. Who is doing these interventions? The interventions are mostly done by the nurse. So a lot of the interventions will be reflecting the nurse here. So you can write I will, or If some interventions will require the patient to come in, then bring in the name patient will. So here you list specific actions that you plan to help for you to achieve the goals. Use active language. Active language means this is an action that is yet to be implemented, so you'll be talking about I will. Do not say I did this, I had done this. No, we're not talking about history. This is an active care plan and the work is supposed to happen. Do not use encouraging words or do not use try. You need to use words that are realistic. If you just say we will try our best to, no, you need to bring in actual words. We're not encouraging anyone. We want to bring everything into reality. So use words that are nurse related, teach, explain, provide, monitor, administer, assess, consult, collaborate, report. Those are medical related work or professional words. Don't bring also street words. Sometimes maybe your language also matters as you're writing the care plan. So don't make it too layman's until now you forgot the professional part. Then try also to put your word into an individualized kind of care, because the care plan, as much as we know, there is also the standard. Please try to work more on the individualized side, because individualized care plans are way more effective as opposed also to the standard, because individualized, like we said, they focus on that particular patient at that particular time. Okay, so you are giving your interventions as exact to that particular patient as possible. And after intervention, there's a column of implementation. So who did it, when, and how. So explain who did it and why. So some columns will come with intervention plus rationale in the same column, while some care plans will have rationale as a second column. So when you have interventions, you can either decide you explain it within the same column, or you introduce another column and put rationale. Rationale is where you're explaining the reason why you're going to do the particular action, while the next column then will now be the implementation. So in the implementation, this is where you will explain who did, where, and when. And the last column is just the outcome. So in the outcome, you explain if the goal was met, if the goal was not met, what do you propose? Should you encourage more walking? Should you encourage more ambulation with assistive devices? Or are you encouraging the patient to be discharged? So these are just a recap aspect that I needed us to remember before we go to the next parts. So this is an example now, one of the examples. So like I told you, there are some books where you will find nursing diagnosis combining with the data, and the data can be in two sections, subjective and objective. While you'll find now, again, you'll find the interventions being combined with the rationale, like where you're telling us the reason why. Then we have the implementation, whereby you tell us, did you implement or didn't you implement? And the last part is evaluation and outcome, telling us the status of your patient after you've given in your interventions. So in the nursing diagnosis, which is now guided by the data, which can be subjective or objective, you can do this in two ways. There are people who prefer writing the data combined, talk about the patient and the nurse at the same time. Others will prefer highlighting it. So highlighting, we mean you can generate objective data first and then bring subjective data. Objective data, this is data that is supported by evidence and research or medical knowledge. So in this case, the patient could be giving the subjective data, or this is data originating from the patient based on how they are demonstrating their symptoms or based on how they are reporting about their health status. So the subjective data is simply the action and words as generated by the patient. The objective data is on the other side, is the status of the patient as interpreted by the nurse, or in this case by the health practitioner. So for example, in this patient, the patient is not oriented to place or time, patient is not able to concentrate. Subjective data, what is the patient doing that you saw? So patient nonverbal uses nonsensical word. You can even write the words that the patient is talking that don't make sense. Then with this data now is when you come here and get your diagnosis. So like in this case, the nurse here has chronic confusion related to traumatic brain injury as evidenced by disorientation and cognitive dysfunctions. So if you look at this diagnosis, the chronic confusion is a stem that is generated from the Nanda, okay? This one, she didn't get it from her mind. She got it from Nanda. And then the related to is the reason why the patient could be showing us all these behaviors, not oriented to place or time, not able to concentrate. That is the reason why, the cause, the one that we're saying, etiology, pathophysiology, or causes of all these risks. And evidence, what is showing that this patient has chronic confusion? There's disorientation, there's cognitive dysfunction. You can also put together all these words and say patient not able to concentrate, patient using nonsensical words. These are all possible evidences. Just bring them down here and it will make your diagnosis complete. So I hope I'm helping someone here. Then on the goals and objectives, here we say you are simply telling us what you expect to improve on your patient as you're implementing our care plan. So here we have patient will be oriented to self within 3 weeks, you see. So we said 3 weeks, this is a long-term goal. Patient will be oriented to person, place and time by discharge time, and patient will be able to perform basic ADLs by discharge independently. So as you see, as we flow with this care plan, I will dwell more on this, and then on the other one, I'll just run them silently so that you're able to read and connect. So as you see in the goals here, you are generating goals based on the data and based on the diagnosis. And this lady has 3 goals. Now in these 3 goals, you will need to tell us the interventions and why. So the interventions are not tied, like you need to specifically say about orientation, what are you going to do, about place and time, what are you going to do. You can generally just state all of them. You don't need to break them down all the way to the goals and objectives. You can generally put interventions targeting the whole diagnosis. So in this case, this lady has identified self and patient by name, or that is calling the patient by name. Why is this person doing that? Because they want to create consistent orientation that may help memory. They also talk about maintaining calm environment. This is to decrease anxiety and promote rest. They say when a patient is perseverate, they have to redirect to another topic. This is a way of improving self-esteem and decreasing anxiety. The nurse says he or she will speak slowly and clearly and in using simple sentences. This is to allow the patient to have time for information processing and also boosting memory. So there is an aspect where he or she wants to bring teamwork. So he talks about consulting speech therapist, and he's planning to educate the patient and family regarding the pathophysiology of injury and the resulting cognitive dysfunction. And the rationale is that this will help assisting in understanding of the patient behavior. So these are the list of actions this nurse is aiming to do. But implementation now, when is it going to be done, by who and where, and was it done? So at the end of the day or at the end of the 24 hours, you need to state this. Other people prefer that you update the implementation as time goes by. So maybe if this was being written at 7 a.m. and at 11 a.m. someone came and implemented, then you can come just and state 11 a.m. Nurse Helen came in and administered, let's say, anxiolytic medication for this patient. Write it there. Let's say the speech therapist came at 1 p.m. can talk about speech therapist came at 2 p.m. and had a speech therapy session with the patient. Write it there. At the end of the 24 hours, you come and state the outcome of the patient. So how do we evaluate the outcome as generated from the goal? So the patient will be oriented to self within 3 weeks. What are the changes? This one here is saying no measurable change yet, patient still confused and disoriented. We need to continue with our goal. So in the next nursing care plan, this diagnosis will maintain and the goal will also be maintained. Patient will be oriented to person, place and time by discharge. At the end of the day, any changes, the nurse says same as above, continue the goal. Goal number 3 was patient will be able to perform basic ADLs by discharge independently. So the outcome is the patient performing same ADLs with physical assistant and verbal cues. What do? Continue with the goal. So in this case, if the goal is achieved or the goal was not met, In this case, you determine what next do you do. So you need to state the next action that is to be taken. So this is an example of one of the care plans. Yeah, and again, here is another one, but like we said, for the student purpose, this is for learning purposes. It is not for any other reason. It's for you to learn, understand, and just enjoy the journey of writing the nursing care plan. So this is another way of putting it together. This is a diagnosis of pain. Like I said, in the next example, I'll just run it silently so that you can be able to read through and understand and connect what we are just saying. So 1 minute of silence. Okay, so here is another one that we can use. This is more refined, clear, and it's including all the parts except the biodata of our patient and the date and time. Yes, and on the date and time, before I let this one also run silently, is when you're writing the date and time, ensure the date and the time at the same time. Remember, you assessed this patient at the same particular time of the day. So if you're starting your care plan at 7 a.m., your assessment data, all of it needs to be reflecting 7 a.m. Do not have a case whereby your nursing diagnosis number 1 was done at 9 a.m., nursing diagnosis number 2 is running that it was done at 8 a.m., another one was done at 7 p.m. You know, you need to have a standard time where you did each and everything and came up with the nursing diagnosis. So run the time, same date, same time. If it's 7 a.m., 7 a.m., all of them. And please note, most nursing care plans begin in the morning. They don't begin at midnight, they don't begin at 10 a.m., they don't begin at 12 midday. Morning hours, when the shift is starting at the particular time of the day, depending on what time your morning shift begins in the hospital. If it's 6, 7, or 8, that's all, but you need to begin it in the morning. So here's another 1 minute of silence as you can read through and just enjoy how to bring it together. Okay, that's it. I hope you've enjoyed this unique series on nursing care plans, and from now on I hope you will have easy time coming up with this nursing care plans. More about how you felt about the series, and you'll enjoy to get your feedback. Otherwise, thank you so much for keeping us with us, and see you in our next series. Bye.